Healthcare in the United States is going through a political reckoning, with lots of ideas on how to reform or completely change the way people get and pay for health insurance. Many on the right want to move toward a more privately run system, with less insurance requirements on individuals, health insurance companies, and employers, and less government subsidies and funding.
We want all the providers of healthcare services, insurers, doctors, hospitals, everyone competing against each other for our business as patients, as consumers.
But Republicans are splintered on just how to roll back the government's role in individuals' healthcare, something that came to a head when 4 different plans failed to pass the Senate in July. The left, on the other hand, wants to boost those public government programs and coverage requirements to give more Americans health insurance.
Democrats believe that health care is a right for all.
One of their buzziest ideas is single-payer healthcare, where the government is the single payer that pays for Americans' health insurance through a tax-funded plan. Single-payer is a type of universal health coverage. That's where the government ensures that every citizen has health insurance. There are lots of ways for governments to implement universal health coverage. At least 30 countries have some form of it. The way our system works right now, there are a good deal of Americans who don't have health insurance. In 2016, about 28 million, roughly 9% of the population, were uninsured. And those who are insured have to work with a web of private insurance companies, employers, hospitals, pharmaceutical companies, and government-funded programs like Medicaid and Medicare. Single payer would funnel all of those negotiations into one channel, where the government determines a baseline of health benefits that it will fund for everyone, and sets or negotiates the price for those benefits. Just like there are many ways to get to universal health coverage, there are also multiple ways to implement a single-payer healthcare system. Bernie Sanders and some Democrats are backing a Medicare for All proposal. This would expand Medicare, which currently pays for certain health services for Americans over 65 and those with disabilities, to all Americans. Polling shows that a majority of Americans believe that it's the government's responsibility to provide healthcare coverage, and a growing share of Americans support single-payer healthcare. Those in favor of Medicare for All say that the plan would lower prices for healthcare services and medicine across the board. Americans pay double what many countries with universal health coverage do on health costs, and many say that those costs would be lower if the government could bargain down or set prices. Conservatives are largely against Medicare for All because it would shift more costs and responsibilities to the government and away from the private market, thus requiring more tax dollars to implement.
Get Washington out of the business of being a nanny state.
They contend that it would take away individual choice in health coverage.
This complete government takeover of health care.
Although liberals who support the plan argue the exact opposite.
The choice they made is they want to get quality health care.
And many moderates say that the transition to a single-payer system would be tricky and could upend health insurance coverage if done too rapidly.
As of 2017, healthcare is not protected under the Bill of Rights or outlined in the U.S. Constitution. Therefore, the federal government is not responsible for providing healthcare to citizens of the United States. In order to make healthcare a federally mandated piece of legislature, the legislative branch must propose a bill that has to be passed by both the House and Senate, which then must be signed by the executive branch and be added to the U.S. Constitution. If the state of California wanted to adopt single-payer healthcare, individuals would have to add an amendment to the California Constitution providing all citizens in the state of California have access to healthcare that would be paid for by the state of California by apportioning an amount of collected tax dollars of California citizens go towards healthcare for all. For individuals who believe healthcare should be provided to everyone by the government, single-payer healthcare sounds like a great option. While single-payer healthcare has failed to get passed at the federal level, people in the state of California have opted that we implement single-payer healthcare, branching away from our now practiced form of private healthcare. Yet when trying to do this, we run into a problem. Closing the gap is made harder by several mandates. For example, voter passed Proposition 98, which requires that roughly 40% of all revenue go to elementary and secondary schools and community colleges. The requirement can be suspended by a 2/3 vote of the legislature, otherwise that money is off limits to cutting. The state constitution requires that interest on state debts, about $4 billion each year, be paid before anything else. The state budget of 2017, passed July 1st, is estimated to have a budget of $82 billion, requiring that $32.8 billion go to education. Single-payer healthcare is estimated to cost $400 billion annually, which exceeds the budget by over $300 billion. While there are many pros to a single-payer system, there are also many detriments to implementing a single-payer system. It will destroy millions of jobs. Single-payer systems save money by setting artificially low reimbursement rates for doctors and hospitals, and in many cases, by paying them less than it costs to treat patients. That would drive healthcare providers into bankruptcy and eliminate 11 million U.S. jobs. It also forces patients to wait for care. Millions of people would languish on wait lines for doctor's visits, tests, surgeries, and more. In Canada, the average patient waits more than 4 months for surgery after receiving a referral from her doctor. The Red Cross has called wait times in the United Kingdom a humanitarian crisis. The ration of prescription drugs is also a risk. To control costs, a single-payer system would restrict access to advanced medicines. The United Kingdom's National Health Service doesn't cover specialty immunotherapy drugs. Japan's government also restricts access to specialty drugs such as cancer drugs. It also restricts research and development. Single-payers price controls would reduce incentives for scientists and companies to develop new medicines. Price controls implemented by foreign countries, single-payer systems prevent the creation of 3 to 4 new drugs each year according to the U.S. Department of Commerce. It also hikes up taxes for U.S. taxpayers. A single-payer system would require a new tax on income on top of all the taxes Americans already pay.
Advocates of a single-payer system believe it would cover more people at a lower cost. But there's a fundamental problem with the single-payer model. To expand coverage to more people, the government has no choice but to reduce access to certain drugs, procedures, and doctors that we now enjoy. We can learn from the experience of the single-payer model in the UK, Sweden, and elsewhere in Europe. The wait times for diagnostic procedures, doctor appointments, chemotherapy, and surgery are so long that their governments have turned to private care, sometimes even private care in other countries. And then there's the issue of health outcomes. Because of the long wait times to receive treatment and restricted access to specialists, medications, and medical technology, health outcomes in single-payer systems are worse than the US for almost all serious diseases like cancer, heart disease, and stroke. In practice, the better bargaining power of a single-payer system usually means price controls and regulations that cause shortages and prevent people from getting the care they need in a timely fashion. So while our healthcare system does need to change, a single-payer system isn't the solution.
As stated, it is not outlined in the Constitution that all individuals are protected under the law to have equal opportunity to obtain healthcare. People want access to healthcare, but healthcare comes at a cost. Individuals who provide the services must be paid at a fair rate to provide incentives. This makes the private sector of healthcare the suitable option. Then there are those who want the government to run a single-payer system which takes away incentives because they believe healthcare is a fundamental right and doctors would be paid at a less than fair rate. These controversial beliefs bring us back to square one and are preventing the U.S. government from coming up with a form of healthcare that meets both parties' wants. Rather than providing healthcare for all citizens in the United States or at the state level in California, we propose that healthcare be provided for children enrolled in grade schools from K through 12 or enrolled at a private sector for individuals who attend college, and their health coverage would be added into the cost of tuition and fees, and also for elderly individuals over the age of 65 who have either paid into Social Security or have paid through state taxes at their jobs. Other individuals of the United States would have to obtain health care through private parties and would have to be paid for out of their tax dollars.